Thank you so much, Bob. And as much as Bob gave me such a fantastic introduction, I say this every single time I visit my public libraries. And unfortunately, I missed visiting Morton Grove last week. Um, the most underutilized resource over the last 25 years is our reference librarians. And I will be the first one to say that when I was a youngster, I disliked the Dewey Decimal System. I ran from it. So when I ran into the library, I went right to the reference desk. Where are the martial art magazines? Um, but you have such great resources like Bob Pallas and Melissa and so many members of the team there in Morton Grove that are willing to help and get you the right answers. Let's remember, Google is not right all of the time, but the one thing I can tell you is even if your reference librarian does not have the right answer, they will get you the right answer. And I think that's most important. Should share with you that this PowerPoint presentation will be available to you. So nobody has to really go, bananas, so to speak, and, filling out notes and things of that nature. Whatever is going to be on the screen will be available to you. The only thing you would need to do is, of course, email Bob and let Bob know that you have a level of interest in obtaining this information, and he'll be more than happy to email that on over to you. And then, of course, you can always go to the YouTube channel, which is always a great thing. My name is Tom Kilkenny. I am with Weiss Financial Ratings. One of the things I'm going to get right off the table before we go any further, I am not here to sell anybody anything. 36 years as a wealth manager. About 5 years ago, I decided to pump the brakes and sell my practice and trade in working with some pretty demanding clients. And now I get the opportunity to work with wonderful librarians like Bob, and it really is a 180, and it's fantastic. So my days of selling anything to anyone are long done. So today, my ultimate goal is to let you know what Medicare will cover, what they don't cover. Um, based upon your unique health coverage needs, we'll go over some of the supplements that are available to you, like a Medicare Advantage, and then, of course, the Medicare supplemental Medigap. Um, One of the fantastic things is Weiss Financial Ratings database is provided by the Morton Grove Public Library. They subscribe to this great tool because they truly feel that it is a valuable resource, especially to their senior patrons there in Morton Grove. Both Weiss Financial Ratings, which falls underneath the umbrella of Gray House Publishing. Gray House Publishing has been around for over 50 years now, predominantly providing print reference material for libraries across the country. And underneath that umbrella is such reference material like H.W. Wilson and Salem Press, and of course the Weiss Ratings financials. So neither one of the organizations make any markets in securities, nor are there any trading in any of accounts. So as I go through the segment here, the one thing that I can promise you is that I am going to be very independent today. I am going to be 1000% unbiased. And the one thing that we can always promise you is that we are accurate. Now, as we go in, it's very important. I may mention some names of companies and things of that nature. Please do not misconstrue me mentioning a name of a company. It is not meant for you to do business with that company or not do business with that company. I may mention a company name simply based on example purposes. You will see I'll give examples of some seniors at a specific age and how much a policy could cost them. There is no name of the company that is provided. However, as I'm going through, if you feel you'd like to know the names of the companies, I have no problems divulging that information. So if you see an example and you say, hey, Tom, what's the name of the company? Just simply unmute, and I'll be more than happy to divulge that to you. So without further ado, I'm going to go ahead and I'm going to get started here. The Medicare Medigap discussion that we'll be having today is designed to help you navigate through the Medicare maze. It's exactly what it is for a lot of people. It's a maze. It's very confusing, especially for people who are just getting involved in Medicare. They've just initially enrolled into Medicare. And my primary goal is to tell you about choices that you do have available to you to help you save as much money as possible. One of the nice things is when we deal with metropolitan areas like Chicago and New York, we have such a wide range of insurance companies that are available to us, but the likelihood is of us saving hundreds of dollars are probably nil. We'll be saving thousands of dollars. At the end of this talk, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies and, of course, for the least amount of money. And why? It's because the Morton Grove Public Library has decided for many years to subscribe to the Weiss Financial Ratings database that has this Medicare supplemental pricing tool for you. Here's some of the things that we're going to cover today. Major expenses that Medicare doesn't cover. When is open enrollment and what does that actually mean? Many of you, we're one day deep into open enrollment right now. Why Medigap can be better than Medicare Advantage. And you see how I added that word in there, and I'll circle it there. It can be better. I will say that probably 9.5 out of 10 times it is better. But of course, certain circumstances, Medicare Advantage may be just fine for you as well. How to get lower premiums and save hundreds? Let's X that hundreds out, even thousands of dollars. And you'll see on just how to utilize this tool if a Medicare supplemental policy, a Medigap policy, is appropriate for you. I think one of the things that everybody needs to do every single year is be a prudent shopper. And you should always shop every single year. You should take a look. Make sure you're keeping insurance companies honest with their premiums. If not, there are other insurance companies out there that maybe will stay a little more honest with their premiums. When can we join Medicare? Well, we have that 7-month initial enrollment period. We have the 3 months before our 65th birthday. Obviously, we have the very month of our 65th birthday, and we have up to 3 months after our 65th birthday. The open enrollment period is October 15th to December 7th. So if we wanted to add any supplemental coverage or make changes to any of the supplemental coverage we have between October 15th and December 7th to make those selections. If we're still working and we're covered by our employer insurance, Medicare can certainly supplement the employer coverage as well. I also should point out, and I probably shouldn't say this too frequently, but I am not the expert when it comes to Medicare. I know more than enough to be super dangerous. You will see as I go through the presentation, I will point you out to the experts, and those are your ship counselors right there in the Chicago area. They live and they breathe Medicare and supplemental policies. They work for the government, and they come to you with no fee. So again, no more than enough to answer any questions that you may have. However, if you need to get super strategic with your coverage, whether it's a couple, maybe one is still working and you want to know on whether or not should I enroll or should I wait to enroll, ship counselor is the perfect person to speak to. When can you change your plan or your insurer? Well, this is pretty important. If you have a Medigap plan now and you want to change your plan or your insurer, you can do so during the open enrollment period, which is from October 15th to December 7th. Now, one of the things that's super important, especially if you have a supplemental policy. Some people um, never go for the most comprehensive coverage when it comes to supplemental policies. Maybe your spouse is still working, um, or your partner is still working, and um, going overseas is not important to you right now. But once we retire, things may change. So some may elect to go with a little less coverage. Because maybe they're not going to be traveling abroad. But it's really important because so many people hit a stage where maybe they go from plan A, plan B to a plan G. And let's say they enroll October 30th. I have heard sometimes people immediately start making appointments for things that are outside of their current network. And next thing you know, they're meeting with those physicians or those medical caregivers in December. And next thing you know, they get that medical bill and they say, "What is this? I have Plan G." Well, it's really important that coverage does not start until January 1st. Really important. I mean, I know it's right there, it's black and white. You'd be surprised on how many stories I've heard that people, they felt like because the person on the other line said, "You are binded, this is your coverage." Most of the times they'll say starting January 1st, but sometimes we all have selective hearing. So, really important for us to take that into account. Here is understanding Medicare coverage. Now, I always say that this is somewhat misleading sometimes because really Part A and Part B is a part of Medicare, where Part C and Part D is really not a part of Medicare. Um, and I'll certainly go into that in more detail. You'll see Medicare Part A, it's your hospital insurance. Medicare Part B, your medical insurance, like your primary care physician. Medicare Part C is the Medicare Advantage supplemental plans. And then, of course, Medicare Part D, prescription drug coverage. As many of you may know already, Medicare doesn't offer prescription drug coverage, but we'll certainly go into that a little deeper as we go into the presentation. Medicare Part A, it covers hospital-related services and emergency care. It's the inpatient hospitalization, home health services, skilled nursing services, and hospice. Now, Medicare Part A does not cover all of the hospital costs, and it does not cover long-term care. So again, really important. It does not cover 100% of the costs, and it definitely doesn't cover long-term care. Medicare Part B, this is your primary care physician, doctor's office visits, laboratory services, ambulatory services, as well as diagnostic services. Now, when you see both Part A and Part B, you're sort of saying to yourself, I feel like I'm totally covered. That amount covers everything. Medicare does not cover all the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. The next slide I'm going to show you is pretty comprehensive. These are out-of-pocket costs for 2025. Now, of course, anybody who has Social Security or has Medicare Part B, this is our monthly premium, $185 or more, dependent upon your income. I believe those thresholds are if you are filing single and you earn 113,000 or more a year, it may go up 11 or $12. If you are a couple and you secure income of $166,000 or greater, again, it will go up usually right around 11 or $12. So, but to be candid with you, anybody earning that type of income in retirement, I'm not sure if an extra 11 or $12 is really going to rock the boat for them too much. Now, when we talk about our Medicare Part A, that's the hospital deductible. This is if we were admitted into the hospital, and days 1 through day 60, we would be responsible to pay the first $1,676 before Medicare would pay anything. Now, if we were in there 61 to 90 days, we would be responsible to pay the first $419 per day. So if the cost was $600 to be in the hospital per day, we're required to pay the first $419 before Medicare will ever pay the $181 to cover the rest. God forbid we were in there 91 to 150 days. It's $838 per day. And anything over 150 days, we're on the hook for everything. Now, our Part B, which is our visiting of our primary care physician, we have our Part B annual deductible, which is $257 a year. And if we were in a skilled nursing facility, the first 20 days is obviously always covered, but days 21 through 100, we are responsible to pay the first $209.50 per day. Now, after 100 days, we are responsible 100% for all costs. Here are some other hidden costs of Medicare, and none of these items are covered. This really hits home for somebody like myself. Prescription drug coverage. Well, right off the bat, being from New York, it's a prerequisite. You're going to have high blood pressure. And, so me, I take Ramipril, which is, keeps the blood pressure down. Two, vision. Well, we already see I need glasses. Emergency care abroad. Now, me personally, I do a lot of traveling, especially overseas. Really important that I have that type of coverage when I'm visiting Asia and Europe. And then, as some of you have, before we started recording, I'll let you know, I do have a body by Portillo's, and I do enjoy my Chicago Prime steak and Morton's. And everybody needs a good set of chompers to be able to enjoy a good steak. And then last but certainly not least, hearing aids. My kids tell me quite frequently, Dad, you need hearing aids. I sort of tell them it's a select listening. You have choices and individual needs will vary. One of the things that we all have to grasp is that when Medicare was established, back in 1965, Medicare was never meant to cover all of your medical care for your senior years. It really was just intended to cover the most basic of needs. Now, again, one thing that the government knows is that when you pay into a system, you are entitled to Social Security income. And that $185 typically comes from somewhere. And 9.5 out of 10 times, it will come from your Social Security income paycheck, so that they're going to get paid. And they offer you that Part B coverage. And what this Part B coverage does, which I think is fantastic, I think it's great for our seniors. Many years ago, I come from a Sicilian background. Many of us feel like extra virgin olive oil takes care of everything. That's not the case. It is so important for us to visit our primary care physician at least once a year. Make sure that we, aren't prone or have any diseases or any illnesses. And again, because, we are required to have Medicare Part A once we hit into our Social Security years, that we have that opportunity to go and get checked and make sure that our most basic needs are being covered. And of course, we have choices. We can stick with the Medicare Part A and Part B, and maybe to shake the dice a little bit and see maybe if we are at optimal health, or you can make a purchase of additional coverage, whether it be through Medicare Advantage or the Medicare supplemental Medigap policies. And you can make this decision, of course, based upon your unique healthcare needs. I always say it's very important to look at family medical history as well as some of your own medical history. that should really help you be able to determine on whether or not a supplemental policy would be appropriate for you. There are two choices to fill the gap. You have the Medicare Advantage Part C, and we have the Medicare Supplemental Insurance, better yet known as Medigap. Now, we'll go into what Medicare Advantage is. And remember what I said, Medicare Advantage Part C really isn't a part of Medicare. Well, here it is in broad terms. The coverage is provided by a private insurance, and it is limited to a defined network of doctors and providers. So again, Medicare Advantage, these are third-party insurance organizations. They are not a part of Medicare. It combines your Part A and your Part B, and oftentimes it'll include Part D, which is prescription drug coverage, which I always say is the magnet of the Medicare Advantage plans, because if we don't have prescription drug coverage, we don't have that Part D, Medicare likes to give us a lifetime penalty on that, and nobody wants to pay any penalties. But most of the Medigap policies do not cover prescription drug coverage. So again, people immediately start gravitating towards the Advantage plans, not knowing that even if you call a Medigap supplemental policy company, you can ask them if they offer a small prescription drug coverage plan. More often than not, they do. Medicare supplement insurance, better yet known as Medigap, it covers those deductibles, the co-payments, and the co-insurances. What I mean by that is that $1,676, the $419, and the $838, or even the $209.50 for skilled nursing facilities, all of that is covered with these Medigap plans. It's designed to fill the gaps that Medicare Part A and Part B does not cover. Here's a great side-by-side comparison. Here we see on the left-hand side the Medigap, original Medicare, and Medicare supplement. We may have higher premiums, but again, we don't have many of those co-pays that we spoke about just briefly. We do have the freedom to choose doctors. I know for a lot of people, that's super important to be able to select your own doctor. No referrals are necessary. Some of the downfalls with a Medigap plan, some of the routine services that are not covered, like vision and hearing, those are typically not covered in a supplemental plan. One of the big bonuses, you are covered anywhere in the continental United States, and 6 plans actually offer coverage abroad. Medicare Advantage plans, you generally have lower monthly premiums, but you do have those co-pays. You may be restricted, and most of the times you are restricted to a network of doctors. You may need referrals for specialists. Some of the great benefits is the extra benefits. Most of the time it does include vision, hearing, and fitness, but this is super important. Outside of your service area, you are limited to emergency services only. So as many of us, encroach our retirement years, or maybe some of us are knee deep in our retirement years, we may have family members maybe in the Northeast, or maybe down in Florida or the Carolinas, and maybe we like to visit them. Let's hope that we don't get injured or get sick to a point where we go to the emergency room and then get admitted, because then that's when some of those bills will certainly start to stack up. Whereas on a Medigap supplemental plan, you're covered anywhere in the continental United States, and it isn't just emergency services only. Secret number 1, and this is pretty important, Medigap plans offer identical coverage. What I mean by that, Medigap has 10 plans. Plan A through Plan N, Plan G and H have high deductible plans as well. And what this means is that for every lettered plan, every insurer that offers that plan also provides the same exact benefits. The plans are regulated by the government. So the coverage within each lettered plan is the same, regardless of the insurer that you select. So if I wanted a comprehensive Plan G, it doesn't matter whether I have Humana or United Healthcare. The benefits and services are going to be the same. It is government regulated. The only thing that's not regulated through the government is how much you pay. And that really is where that pricing tool really comes in handy. And again, that means, again, all Plan A's have the same exact coverage. Plan B's, Plan F's, Plan G's, they are all the same. You can pick the plan that has the best coverage that you want. You can compare one insurer to another. And of course, you could pick the plan that has the best rate. Who wouldn't want to do that? Questions you might want to ask yourself when possibly picking a Medigap plan. What is your income? One of the things as a wealth manager that I always stress to everyone, including my own children, you never want to be house poor. You never want to be car poor. You never want to be insurance poor. Make sure you get the coverage that you feel comfortable with, and make sure you don't overstretch your wallet because that never feels good. You always want to be able to keep the coverage and feel comfortable paying for the coverage that you're obtaining. Do you think you will want or need nursing care? Look at your family's medical history. I share a personal story here. Many times, my mom had a cardiovascular disease, and she had a series of mini strokes, and then unfortunately she had a huge stroke. And my parents were separated at a young age, so I was my mom's healthcare proxy. And sure enough, the doctor said, "Hey, this one was a tough one. Since your mom lives alone, it is most likely that she's probably going to need some 24/7 care. And I'm going to recommend that she goes and spends a sizable portion in a nursing care facility." So, of course, they sent her to a wonderful facility right across the street from the water in Long Island, New York. Um, Mom would go out there and feed the seagulls with the bread and stuff. And remember what I said, the first 20 days is always covered. And being the healthcare proxy, I got that phone call on the 19th day. Tomorrow is Mom's last day that the insurance is covered here, and we don't accept her insurance. We'd like you to come in and talk to the social worker, and let's see what kind of facilities there are out there that we can provide the care for your mom. And so, of course, I went in and I sat down, and of course, my mom joined us. And as I'm looking through the list, I'm saying no, 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 because I know the neighborhoods. I don't like the neighborhoods, and that's just a personal thing for me. And then the one thing that always sort of burns in the back of my brain is the greatest thing, but the worst thing happened to me. I lifted my head up and I looked at my mother. And she looked at me and she said, "Tom, I don't want to go anywhere. I actually really like it here. The food is good. The people are friendly. We play games. We have watch nights. I really like it here. I really want to stay here." Now, that's my mother. I'll give anything for my mother. And I will say this too, I have not worked my entire life so that I would tell my mother or my father or my wife, no, that'll never happen. Not as long as I breathe the air of the earth. So I said, "Is this what you really want, Mom?" And she said, "Yes." So I gave them my checking account and I said, "Just debit it every month." Well, my mom spent 15 months in that facility, and I think I actually got away pretty cheap. It was about $109,000. But here it was, as a wealth manager, I was so busy managing everybody else's needs, not just like your typical shoemaker, just not taking care of the needs of my own family members. And I paid the price for that, but it's a price I would have paid tenfold because my mom was super happy at least the last 15 months of her life. That was important to me. So again, I always say this, I'll probably myself personally get a plan G because I never want my kids to lift their head and look at me and say, I don't want to go anywhere, Lorenzo or Chase. So again, it's really important. Take a look at your family medical history. Do you travel a lot overseas? Well, if so, you can get coverage for emergency care in foreign countries with Plan C through G. And then, of course, you have M and N. Those are those six policies, plans that will offer you that type of coverage. Deciding between Medigap plans, well, paying a higher premium for that more comprehensive coverage, like I had made mention, Plan G and Plan F are almost like a PPO. Besides the Part B, $257 deductible, pretty much everything else is covered. Or if you feel like you're in great health and you want to take on some of the risk yourself, pay a little less of a premium, and that means you're gonna roll the dice against the wall a little bit, and there's a possibility you may pay a little bit more out of pocket. Maybe for myself, if that was the case for me, maybe I wouldn't visit Portillo's so much and have a cake shake every time I enter the building, but I'm going to live my life. And whenever I'm in the Chicago area, I'm going to have the cake shake. Here's a super comprehensive plan. It shows you exactly what Medigap benefits are included. And here it shows you Plan F and Plan G is the most comprehensive. Now, unfortunately, Plan F is no longer offered. However, I will show you another slide. And in that other slide, it does show that if you had Plan F prior to January 1st of 2020, you were grandfathered into Plan F and you can keep Plan F. If you were not, you can't get it after January 1st of 2020. Most go to Plan G. That is the alternative. The only difference between the two is obviously that Part B deductible. It's covered Plan F, but it's not covered in Plan G. Now, what that means is the only difference is that I'm going to pay that $257, where in Plan F, it was covered. But if you go ahead and you take a look at annual premiums, and this is the least expensive premiums for a 65-year-old female in Illinois, Plan F, the annual premium on the low one was $19.68 a year. For Plan G, it was $16.27. So really, when you take a look at everything, the difference between the two, you're actually saving more money in a Plan G because there's a $341 difference between the annual premium of Plan F and Plan G. And what was the only difference between the two? The Part B $257 annual premium. And if I minus that $257, I am ahead of the game by $84. Hey, $84 is $84. So Plan G seems like it's a good place to be. Secret number two, we spoke about this briefly. Medigap plans are standard, but the rates are not. Insurance premiums can vary thousands of dollars a year for the same exact coverage. Now, here I'm going to go into some examples of a 65-year-old female in Morton Grove and a 68-year-old male in Morton Grove. And then, of course, I'll combine as a couple. We can get a pretty good indication of why it's important for us to be smart shoppers. And one, get the coverage we need, because we already know if we get a Plan G, that coverage is really going to be blanketed across the board because it's the same. Whether it's a Plan G, all the services will be the same. Plan B, all the services will be the same. But let's make sure that we're not overpaying for that coverage. Here we have a female age 65 living in Morton Grove, Illinois. By the way, these numbers were actually pulled this morning. Now, I did both of these off of a Plan G, which is the most comprehensive policy that's available. And the most expensive was a national name brand company. The cheapest was not a national name brand company, but what I did was, because I wanted to compare apples to apples and oranges to oranges, I pulled the cheapest national name brand company. So let's go ahead and let's see. The Plan G, the annual highest premium was $5,404 per year. Now, because this young lady has access to the Morton Grove Public Library website and she has access to this supplemental pricing tool, she went ahead and she did some shopping and she found the same Plan G for just $1,828 a year. Because she was a smart shopper, she saved $3,576 a year. In essence, the analogy that I always use is, if you tell me that you're looking for a Plan G, I'll use the analogy of chocolate chip cookies. I'm going to send you to the chocolate chip cookie aisle. You are going to have every variety of chocolate chips there, whether it's soft batch, super chunk, whatever your heart desires, and the pricing is all there. You make the selection. Never feel like you're getting bombarded during open enrollment period, which is where it is right now, where you're getting infomercials. You're hearing people talk about supplemental policies over the television, or you're receiving emails, or maybe even brokers are calling you. Remember, brokers only get paid if you sign on a dotted line. Let's make sure that when you find the coverage that you feel is most suitable for you, again, that we're not overpaying for it. This young lady did just that. She was a smart shopper, and she went in and did not overpay. And she actually saved herself really what many could say is a 10-day all-inclusive cruise. Here we have a 68-year-old male living in Morton Grove, Illinois. Now, just to give you a heads up, it wound up being the same exact companies being the highest premium and the lowest national name brand premium. The highest was $6,100 a year. Because he shopped, $2,253 a year. He saved $3,847. Now this is where things really start to look overwhelming. We have a couple age 65 and 68. Again, same companies. All I simply did was combine the premiums. Plan G's highest premium together as a couple was $11,504. I see that number and that scares me. It definitely scares me. But because they went ahead and they were smart shoppers, they found a combined lower premium of another national name brand company for $4,081. That number is a heck of a lot more palatable than some of the others. And, you know, with that being said, at $4,081, it's for the couple, it's about $340 a month for that super comprehensive coverage. That's something I think somebody might be able to afford in retirement. They wound up saving $7,423. Now, I'll say this to you. I always give this example because I think this really should drive things home. I'm going to give you three scenarios. One scenario, extremely achievable. The other two scenarios, probably very unachievable. The first achievement is that we enter Medicare and we live 10 years through our Medicare lives. So maybe 75 years of age. Very achievable this day and age. So again, very easily achievable. Premium rates remain stagnant. They go nowhere. I think we all know that that's a big goose egg. That's not happening. And that inflation remains stagnant. I think we also know that that is a big goose egg. That is not happening. But let's hypothetically say that we're into astrology and we're looking at Orion's belt and the stars align perfectly. And this couple was able to live 10 years in Medicare and nothing changed. How much money did this couple actually save? Almost $75,000. That's a brand new, beautiful Lexus. And I would much rather my grandparents drive around in a brand new, beautiful Lexus than to give it to the highest premium name brand company, which nobody's even asked me what the names of the companies were. One of the first groups of people had not asked. So I didn't know if that was something that you wanted me to share or not before I leave to the next slide. No? I don't know if the library has everybody on mute, but if you
I've gone ahead and unmuted or given the option to have them unmute. Sorry about that.
no, that's okay, Bob.
Yeah.
Did anybody want to know?
Yes.
Okay. All righty. Well, the highest premium was the United Healthcare through AARP. The lowest premium was actually a company right in your home state, right there, the State Farm Insurance Organization. Now, for many years, the United Healthcare through AARP was rated a C or a C plus in regards to their safety rating. And people ask all the time, what do safety ratings mean? Everything that we do is fundamentally driven. So everything is numbers and index related. Those numbers are usually submitted to the Security Exchange Commission. And then, of course, anything insurance wise is submitted to the State Insurance Bureau. So you really can't fudge those numbers. If you fudge those numbers, somebody's going to chase you. And that's never a good thing. So it's their ability to pay. We pay thousands of dollars in premiums every single year in hopes that we never need to use the benefit. But especially when it comes to healthcare insurance, a lot of times we do need to use the benefit. Let's make sure that we're not going to be working with an organization that we're going to have to play tug of war for an approval or to get something paid. The reason why I bring that up is because the United Healthcare actually, for the first time in 5 years, actually increased to a B minus, which is a pretty strong rating. Now, State Farm has a B safety rating. So not only am I paying less than half the premium, I'm doing it with a more financially sound organization. How safe is your insurance? Well, if there's an A or a B next to it, that means that the numbers look really solid. It's a company that has sound financials. And you really shouldn't have too many issues of a company's ability to pay for a policy. Now, if it's C and it's fair, it's not necessarily a terrible thing, but you may have some issues with them paying. They may be a little more stubborn with their approvals. If it's D or E, for those of you who remember Mr. Louis Ferrigno, better yet known as the TV Incredible Hulk, he might be on the other side of that tug of war rope that you're trying to get a policy paid for. I would highly recommend maybe not doing business with a company that has a safety rating of D or E. Safer insurers are not necessarily the most expensive. And I'm going to say this to you, 7 out of 10 times, this is a very correct statement. Most of the times, the cheaper policies come from stronger companies. Higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. And the last secret is you can make the choice. Of course, the choice is always yours. More coverage for less can reduce our premiums, balance the financial safety of your insurer with your choice of plan. And we'll just recap the 4 secrets that we went over. Of course, Medigap plans, they offer identical coverage. Medigap plans are standard, but the rates are not. Safer insurers are not necessarily more expensive. And of course, you can make the choice. Now, here's some value statements here. If you'd like to take a few moments to read through the value statements. And of course, you get this all for free with your library card because Morton Grove feels like this is a extremely good resource for their seniors to make sure they have the opportunity to be smart shoppers and get the coverage that they need. Here are some common questions. I know I spoke about this briefly back in 2020 when they sort of discontinued the Plan F. People were up in arms. But I think that as I showed you, the annual premiums for both Plan F and Plan G, the only difference is the $257 annual deductible. And we were able to very clearly see that Plan G's annual premium was actually $341 cheaper, which puts us $84 in the green. So not much to really complain about there. The solutions offered by Weiss Ratings customized Medigap report is to help you find and select the best Medigap policy for you with the strongest companies for the least amount of money. Naturally, every person's situation is unique. And if you have more questions, here are 3 people that you could talk to. I'm actually going to add a 4th in there. I always like to sometimes leave little nuggets there for our wonderful patrons. The first person you should talk to is your primary care physician. Your primary care physician will probably know what type of coverage that you'll need, the type of care that you might need moving forward. Always very important that once you find coverage that you like, call the insurance company. Ask all the vital questions that might be important. If Medicare denies this, will you cover it? If there's specific family medical history, ask those questions. And then ask the question, and 9 out of 10 times, they will say to you, do you have a Part D prescription drug coverage? And if you say no, they will let you know that they do offer those type of policies as well. Things to remember: when you run this report, the whole first half of this report will be very comprehensive. It'll go over everything that's covered, that Medicare covers. It'll go over absolutely everything that we are responsible as the insureds and the patient. And it's extremely comprehensive and should give you a pretty good idea on whether or not you should go at Medicare alone, or maybe you should add a supplemental policy. One of the things that I would suggest is talk to them. Most people in insurance companies, when you go direct to the insurance companies, their job is not to sell you anything. Their job is to give you factual information. That is how they receive their bonuses. It's based on customer service surveys, and it's also their peers giving them a rating on the accuracy of the information that was provided. And if they did not ask you if you have a prescription drug coverage or Part D coverage, that might be an X against them and it may not look favorable. So they will ask that question. And if you say, no, unfortunately, I don't have a Part D, do you offer that? 9.5 out of 10 times, I know I love using that scale, but they will tell you that they have a small policy or they have a policy, whether it be the basic or the most comprehensive prescription drug coverage. Now, I did make mention I am not the expert in this. Your SHIP counselor, your state health insurance assistant programs counselor. You can get personalized one-on-one Medicare counseling over the phone or in person to help you further. You could locate a SHIP counselor in your area simply by just visiting this website here that I have jotted down. Again, at the end of this presentation, if you'd like to have a copy of this PowerPoint, Bob Pallas at the Morton Grove Public Library will be more than happy to email it to you. And the last person that and just so you know, they are government employees. They do not charge you anything. They have absolutely no tooth in the game whatsoever. So they will certainly point you in the right direction and give you the most accurate information. They live and they breathe Medicare every single day. Those are the experts. Somebody else that I would highly recommend seeking information, and this is outside the box a little bit, is your primary care physician's office manager. Let's say the next company right underneath State Farm was the USAA Life Insurance Company. I think they were only about $20 more a year. But the USAA Life Insurance Company is a B+ safety rating. So for some people, they take a look and they say, hey, for an extra $2 or $3, I feel a little bit better going with a B+ company than a B. My suggestion would be when you are talking to your primary care physician's office manager, let them know. Thinking about going with a Plan G, and you're debating between State Farm or USAA Life Insurance Company. Your office manager will give you the right type of advice. Why? Because one, they know the insurance company that pays. They also know the insurance company that gives vast amount of approvals, because the last thing anyone wants, especially myself, if I go into my physician and he tells me, Tom, you have an enlarged prostate. Well, at that point, I'm freaking out. And the last thing I want is, that approval for a diagnostic procedure to be sitting on a table of a 25, 26-year-old sitting in a cubicle that's going to either say yay or nay to that. I would rather know that within 10 to 15 minutes that office manager is setting up the very next appointment so that my nerves can be just brought down just a tad. So again, I think your office manager, one, you're going to make a great friend too, because they already know that you're trying to make their life easy, because sometimes it's that office manager is on the other end of the rope of Mr. Louis Ferrigno, the Incredible Hulk, on the other side trying to get paid. Here's how you can actually access this supplemental pricing tool. You can go to the Morton Grove Public Library website, which is the mgpl.org. Just simply click on Research and Learning, select all databases, and right in there, just put the letter W in. Weiss Financial Ratings will pop right up. If you have any challenges with obtaining the customized Medigap report, again, the most underutilized resource you have is your reference librarians. And reference librarians like Bob Pallas and his whole entire team, they would have absolutely no problems walking you through obtaining your own. And of course, if you're right there in the library, you can certainly go in there and they'll help you run it. Now, again, once you're in the Morton Grove Public Library, You will not need to have a Morton Grove Public Library card number. However, if you do go to access this at home, whether it be a smartphone, a tablet, a laptop, or even a desktop, you will have to have a Morton Grove Public Library card with number. And again, you would access it the same exact way. It's just when you click on Weiss Financial Ratings, it will have a little pop-up box that will ask you for your Morton Grove Public Library number, and then you will have immediate access to that. Now, last but certainly not least, I know I'm a New Yorker. However, I would be remiss if I didn't say thank you. I have to say thank you to everyone.